Hello everyone, my name is Jennifer Yem and I'm here to share some information about respiratory care. Respiratory care could be something you already know about or you don't know at all. Today my goal for you is to open up a whole new spectrum of working in the healthcare field. As a respiratory therapist, they treat and care for patients with illnesses such as asthma, pneumonia, COPD, bronchitis, and to name the most evident one, COVID-19. Respiratory therapists are seen in these locations. At the hospital, they work side by side with nurses and doctors as the healthcare team. In pulmonary rehab clinic, they support patients in recovering and managing with chronic respiratory diseases. In a pulmonary diagnostic lab, patients with suspected lung disorders are referred to specialists, in which a respiratory therapist will conduct step-by-step processes of tests to determine the type of pulmonary diseases, and along with proper treatment. Just like nurses and doctors, respiratory therapists have their own roles when caring for a loved one. They assess patients in critical condition by obtaining vital signs, listening to breath sounds, and interpreting lab values and chest x-rays. They also administer pulmonary medication and assist doctors in procedures such as intubation, bronchoscopy, and resuscitation. Something to know about respiratory care is that it wasn't until the 1940s when respiratory care was established in Chicago. From then on, inhalation therapy, now known as respiratory care, has paved a way to a new line of medicine. Becoming a respiratory therapist has been a life-changing experience for me personally. It has opened my eyes to the world of healthcare, and being able to help manage someone's respiratory disease is impactful and fulfilling. U.S. Bureau of Labor Statistics projected that the need for a respiratory therapist is to be 19% growth rate from 2019 to 2029. Now, this was projected before the pandemic, and since data has not been updated, the need for respiratory therapists are thought to be higher. This is due to COVID-19. Because of this growth rate is growing so fast, there is no need to worry about job opportunities. Now, depending on the education route, certification, experience, and location, the pay will vary, ranging from $63,000 to $75,000, with a median of $69,000. With the growth rate of middle age and older population, this will lead to an increased incidence of respiratory conditions. At Seattle Central College, we are accredited by the American Association for Respiratory Care. This is a 2-year BAS in Allied Health program in which offers practical hands-on experiences, prepares graduates to be competent in cognitive and effective learning. To begin, the prerequisites are basic introduction courses that match majority, if not all, healthcare programs. Now for you young students, these classes are a great start before graduating high school through programs such as Running Start. Or after high school, you can choose to take these courses through any transferable college credits. Once these courses have been established, you can now consider to apply for the respiratory care program. It is simple and straightforward. You start first by attending a respiratory care info session. This is required, and due to COVID, you can attend this session virtually. You can access the info session video on Seattle Central College, and we hope that you attest to have watched and listened to it. Step 2. You enroll for Seattle Central College following the 5 enrollment process. You can find the direct link along with other direct links in the description down below. Third step is to contact advising. I highly recommend you meet with Mark Silva. He is the advisor that supports students who have an education focus on health and medical care. Mark is able to offer resources to students in need of information, creating an education plan, or general questions. Last step, but not final, is to apply to the respiratory care program. It is closed now, but you can have this time now up until next year to work on the requirements listed previously. You can start building your personal statements, completing prerequisites, and gain some medical experiences through volunteering to better your chances of acceptance and knowledge. Transitioning from high school to college is a big shift, especially financially. If you're worried about funding, don't worry because Seattle Central Colleges offers a lot of financial resources. I myself have received scholarships through Seattle Colleges Foundation and a few of my classmates as well. You can also receive funding for earning a bachelor's degree through the Washington State Opportunity Scholarship, which is in the first link. This is a huge opportunity because not many scholarships offers to pay for your bachelorette degree. Ask yourself these questions. If you said yes to any of these questions, then respiratory care might be a career for you. Why I chose respiratory care. I chose respiratory care because I want to represent my community and provide unbiased, equitable healthcare for all. Why I chose Seattle Central College Respiratory Care Program is because this program is set up to branch out into different fields through respiratory care. Thank you so much for watching. Please feel free to contact me through email, jenniferyem@gmail.com, if you have any questions. If you'd like to win a Visa gift card, in the description I have a short survey, and from there you can enter to win. If you know someone who may be interested or a person to provide resources, please share this information about Seattle Central Respiratory Care. All direct links will be in the description.